So as we're coming on in, how is the sound now? How's the sound now? Okay, perfect. Thank you so much. Unique, welcome on in. I thought the sound was there. You couldn't hear me, but welcome on in, Unique. Hey, Mandy, how are you doing? Thank you, Mandy, so much. Surprise office hours today with Dr. Johnson. Nini Legacy, welcome on in. Everyone, as we're joining on in, we are grabbing our daily heartbeat, liking the live, and supporting our goal. I decided to do a surprise extra office hours with Dr. Johnson this week. Once we get to 5K likes, we're going to go ahead and get started. Thank you for the gift, Nini Legacy. Thank you so much for your support. Thank you so much. I have a special guest today that we're going to be chatting with. So I just wanted to make sure I didn't save it until next Tuesday. I brought it to y'all today. Thank you so much for my live goal. Damn, let me reset my goal. Thank you so much. Thank you for the support, y'all. Okay, perfect. I set my new goal. Thank you so much, Nini Legacy, for closing out my goal right as we started the live. Thank you so much. So, as we get to 5K likes, we're gonna go ahead and get started with today's session. It's not gonna be too long, but it's still gonna be impactful. It's still going to be informative. Mandy said, "I'm having a good day." The lighting. I'm having a good day. Had unexpected therapy, but it was good. Okay. Okay, Mandy, why was it unexpected? Did you not set up your therapy appointment, or you just got some good advice from somebody that you know? Y'all hear the music in the background? She ready? What's going on? Thank you for joining. Thank you for grabbing your community fest. Thank you so much, and thank you for you just came on in and just blessed the live. Thank you, She ready. A surprise office hours with Dr. Johnson. Thank you for your support. Thank you for checking on in. Um, okay, work provided your unexpected therapy. I like that. Sometimes employers do that. I remember when I was at the hospital, they offered that. And when I was at another federal organization, they offered that too. That's good. I like that. Thank you for liking the live, everybody. Once we hit 5K likes, we're going to go ahead and get started. Once again, being that this was an unexpected surprise session, I'm not going to hold you guys too long. Thank you so much. And as you all know, moderators, you guys can send out my live. Y'all can, do what you do best because you guys have been holding me down and doing a great job as well, too. So thank you so much. Wait, did I send it to Piles? Let me see if I don't know if I sent it to Piles. One second, one second. Okay, thank you. So, hey, Tara, what's going on? Thank you for grabbing a daily heart. Man, I literally just sent it to you, and I was like, let me make sure I send it to her so she doesn't miss this one. Thank you so much for joining. This was a surprise office hours with Dr. Johnson. Hey, Aaron, thank you for joining on it. Okay, my people are joining. Okay, I'm getting excited. Hold on, y'all. I'm getting excited. What- Hold on, y'all. I'm getting excited. Hold on. This is a surprise office hours. Thank you for joining, everybody. My moderators, y'all can tap in, send it out, and just take over from here. Tara, thank you so much for your support. Thank you for them community fest. Tara, is the community fest contest over? I'm not sure. I don't know how that works. I don't know what's going on with that. Is it over yet or no? Thank you for the 18 community fest. And I'd love to see you guys greeting each other. Aaron, how are you doing? Let me check in with y'all real quick. She ready? How are you doing? What's going on? How's your week been going? Aaron, what's going on? Check in with you. How have you been doing? Tara, how have you been doing? What's going on? I know Mandy already checked in with me. How are you doing, Tara? How are you doing, Aaron? And She ready? And Nini Legacy, what's new with you? How are you doing? Mandy, thank you so much for sending those stickers, you guys. For those of you who don't know, I do have a subscription now, and we do have some stickers. And thank you for sharing those stickers. Those are my office hours logo, the subscribe logo, and the healthcare logo. That healthcare logo shows you. I chose that because I wanted to show you guys that healthcare is collaborative. I love that. Thank you, Mandy. I'm good sitting here working. How are you? I'm doing good. I'm doing good. Today I had a content shoot with another colleague of mine, so it was good. So we're pushing out some good content. Thank you, Mandy. And Mandy got, and for those of you who don't know, the music in the background is compa. That's Haitian compa. And there's a reason why I'm playing that. We're gonna get into that soon. Tara said they have a contest that is still in play for some creators. Oh, okay, Tara, you know I don't know nothing about that, but okay. Thank you for your what you did, your support, Tara. Thank you for sending those in. Oh no, not me like in the live. Um, Tara, I didn't hear your check-in, and she already knows about the Haitian music. Yep, I know she already's Caribbean too. Tara and Nini Legacy, I didn't hear about y'all check-in. Did you guys check in? Let me check the chat because the chat is moving fast. Okay, she already said she's good. Okay, that means she don't. Okay, Nini Legacy said I'm good. Happy about the long weekend. I know we all are. But guess what? In Florida, it's gonna rain. It's been raining all day today, and it's gonna rain tomorrow. So I'm just gonna be chilling, just like she ready. Yup, yup. So as we are here, we are tapping the live. Everybody joining in, grabbing a daily heartbeat, tapping the live. Once we hit 5K likes, we're gonna go ahead and get started. Good evening, Dr. Kimberly Douglas. I came out here just to do an impromptu office hour. So I do have a special guest that I want to share with you all. So an impromptu office hours, Dr. Kimberly Lewis. Thank you so much for joining. Table for Two podcast. Thank you for joining. I'm doing an impromptu office hours with Dr. Johnson. Once we hit 5K likes, we're gonna go ahead and get started. What's going on? What's going on? I almost said your real name. I don't know if you go by your real name on here, Table for Two. But thank you so much for stopping by and showing support. Good evening, Educator Hobbs. What's going on? As you all know, I do my office hours on Tuesdays at 7 p.m. But today I have a special guest that I wanted to come on here and continue to drop gems for all of you on here who are interested in healthcare, interested in higher education, interested in pivoting your career, interested in just being better overall. Okay, because that's what within my community of building healthcare administration, I want to make sure I'm building a community of people knowing that just because you messed up, don't mean that that's going to be a mess up forever. And just because you stop doing one thing, don't mean that you can't continue doing it. So that's why I say I'm big on pivoting. I'm big on starting over. I'm big on having these healthy conversations to show you guys that, hey, just because you stop, you can keep going. I think that that's going to be kind of the tone, the topic of discussion that we're going to discuss today. Oh, they're telling me to reset my goal. Thank y'all for the support. Thank you. So y'all know I'm still a new TikToker. I don't know how to do all of this. I just wanted to come on here and drop gems and share information with y'all. Hold on. Just give me a minute now. Just hold on now. Just hold on. Give me a minute. Let's do these community fest ones. Okay, my community fest, perfect. Thank you so much, moderator, for letting me know about updating my goal. Okay, y'all. Once we get to five, come on, get me to 5K likes. I'm excited. We're gonna bring up my guests. Once we hit 5K likes, we're gonna bring on my guests. Table for Two podcast. Thank you for liking the live. Thank you for showing your support. Thank you so much, Mandy. Once we hit 5K likes, we're gonna go ahead and get started. Why do y'all? Why y'all keep doing this? Just chill. Just chill, man. Just let me just. Mandy, thank you so much, moderators. Thank you so much. Hold on. Okay. Once we hit 5K likes, we're gonna go ahead and we're at 4.5K likes. 4.5K likes. We're gonna bring our guest on up. Good evening, all of you joining on in. Once we join on in, we are grabbing our daily heartbeat and liking the live. We are joining on in and liking the live. You already did 3. Is to push you out to the FYP. You're important. Thank you so much, Mandy. I don't know. Thank you so much for reminding me that. Okay, you're right. You see why you one of my moderators? Thank you so much. So welcome on in. Office hours with Dr. Johnson. Y'all got me to 5.1K. Educator Hobbs, thank you for your support. Thank you for stopping by. And Educator Hobbs, the other night on my office hours, thank you for shedding light and shedding your perspective as it relates to our current government attacking Planned Parenthood. So thank you for feeling as though this was a safe space for you to freely express your goals. Okay, Table for Two podcast laughing at me talking about the 5K. Yes, I got my 5K. I'm ready to talk now. Today, office hours is impromptu. It's a guest who I've had interviewed on here. However, She flew in to Miami for us to do some content. Oh, Table for Two podcast said she was tapping a lot. She flew in and surprise. She came in and she wanted to do her office hours. So you guys welcome on in Dr. Kherveleen Lewis.
Hello, everyone.
Okay, she's not online like y'all. She flew into Miami and she came in. We shot some content today. She wants to start building a community around public health. How is the audio? Is the audio good? Do you guys remember Dr. Kherveleen Lewis? Okay, they saying welcome, Dr. Kherveleen Lewis.
Hello, everyone.
How is the audio? Do y'all hear? You want me to take off or something so I can put?
They hear me, please?
If I put it in the middle, can you guys still hear the audio? Is the audio still good if I put it here in the middle? That's a thumbs up in the. Thank you, moderator. Okay, perfect.
Awesome.
So come close enough so the people can see you.
Yes.
So I wanted to make sure audio is good. Thank you, Dr. Douglas. I want to make sure that she came on here and for you guys to see a familiar face.
Right.
She wants to start building community around public health. She wants to start building community around nonprofit organizations, and she wants to start building a community around mentorship for students who
Right.
are interested in healthcare,
Right.
interested in public health. So I said, hey, you're in Miami. We're shooting this content. You better come jump on the office hours with me. So just one more time, can you just give them an introduction of who you are, and what you do?
Hello, everyone. My name is Dr. Kherveleen Renee Lewis. I'm a public health professional. I serve as an assistant professor at a very prestigious university in New York City. I have a background in nonprofit, so they call it, no, we're not going to say the name right.
Yours? Is it your nonprofit?
Yes, it's mine.
You can say the name.
Okay, the Bread Foundation.
The Bread Foundation.
The Bread Foundation, and we specialize in providing medical and educational resources to impoverished populations, improving the quality of life and improving health outcomes in communities of need. Perfect. Here and overseas as well.
And overseas, yes. And you also do some mission trips. Can we just touch on those mission trips that you do?
Oh, absolutely. We've done mission trips with in concert with faith-based organizations. We have done medical missions in the Dominican Republic, in Haiti. We've done a maternal and child health distribution. We've also done toy distributions for children. We've done youth seminars, youth conferences in the Dominican Republic. We've worked with various nonprofits. We've donated. We've actually done uh, book book back to school. Sorry, back to school fairs within within the Haitian community and for students in Haiti. We've served over 400 students and also have provided scholarships and laptops to certain students in need. So right. We've done quite a lot.
I love that. And that is the Bread Foundation.
Right.
I see in the chat they're saying the Bread Foundation. Where can they find more about the Bread Foundation, or where can they find more about you or want to connect with you?
They could follow me on Curvy Lewis on Instagram, on Facebook, on and now TikTok. Thanks to Dr. Johnson.
Drop in the chat on your phone Bread Foundation in the chat so they can see your page and they can go and follow you.
Yeah, they could follow. We are working on content for the Bread Foundation and also working on the website. So stay tuned. We're a small foundation. We're up and coming, but we've done a lot, and I could always share with you anything that you need. But I'll drop my page on the chat.
Perfect. Thank you so much for that brief introduction, Dr. Lewis. For those of you who don't know, Dr. Lewis and I, we graduated from the doctoral program together. I think we've had this introduction, but just want to say it again because now that she's going to be coming over on TikTok and sharing her acquired experience and her acquired knowledge, I just want to make sure that we know who she is and what she's about and what she's going to be bringing to the table. So we both graduated from the doctoral program, the Doctor of Health Science program. I focused on public health and higher education, and you focused on what?
I focused on health promotion, disease prevention, and global health.
Right, and you did your dissertation on what? I did my dissertation on cultural competency for healthcare professionals. You all know this. You did your dissertation on what?
I worked. I actually did two research projects.
Okay, overachiever.
Yes.
Okay.
The first research project was the importance of education for substance abuse detox patients, and I worked at a center where we were educating them on. We were educating basically families in need, poor families, on how to properly nourish their bodies and linking them to resources within their communities that they could get for free and also through the government.
Mm-hmm.
The other thing, in order to improve their quality of life while they're being detox, while they're going through substance abuse detox, some of them have comorbidities, which are two types of illnesses, two types of conditions. Um, it could either, I'll give you an example. It could either be a substance abuse problem with a mental health condition, for example. And there were many individuals who were coming in to get treatment. The other research project that I did work on is the importance of engineers taking courses in public health while they're completing their studies, because a lot of times they don't think about the population, right? They just
Right.
go in an area, cut down trees, build these huge buildings, but how is your work impacting the community around you? So it's very important for them to understand things like environmental health. Very important to understand how their work impacts the health, the chemicals that they're using, the different equipment that they're using. How does it impact the health of the people around them, such as whether it's pollution,
Mm-hmm.
they're setting, they're working with construction workers, setting
Mm-hmm.
chemicals in the air, etc., etc. So
Mm-hmm.
to look at those aspects as well.
Hey Ashley, everybody just joining in. Welcome on into an impromptu office hours with Dr. Johnson. I just wanted to hop on here because I had one of my colleagues who was in town, so I said let me jump on live and
Mhm.
introduce her. I've interviewed her before, but not in person. I didn't haven't had the opportunity to bring her on in person.
Mhm.
So impromptu office hours with Dr. Johnson. Introduction to Dr. Kherveleen Lewis. We
Right.
graduated our doctoral program together, and I
Yes.
have persuaded her to come over on TikTok and share her public health subject matter expertise
Right.
and build her community around mentorship, around helping students,
Mhm.
and around healthcare administration overall. Let
Mhm.
me ask you something. A student
Sure.
who wants to work within healthcare administration or work within public health and they want to gain experience within community health, where would you say is a good start for them? And for those of you here in the chat, Kirby Lewis, that's who it is. Kirby Lewis
Yes.
is Dr. Kirby Lewis, okay?
Yes. You could follow my pages, and we have content loading up with Dr. Johnson for you all.
Mm-hmm.
Yes. You can
Community,
you just
community
community
health.
health?
Where would you say is a good way? What's a good way for students or a young professional to gain experience within community health overall?
With community health,
Thank you,
one
Nini Legacy. She says she just followed. Thank you for your support, Nini.
oh, thank you so much. One thing I do encourage those individuals. Sorry, I'm
Yeah, no
sharing
problem. I
this
see
live.
you. I see you.
One thing I do encourage young people is to get an internship
Okay.
in a healthcare environment.
Right. Right.
You could do it. There's paid internships, so if
Mm-hmm.
you want to make that money, which is important.
Mm-hmm.
We know the importance of making money when you're a college student.
Mm-hmm.
There are paid internships that gives you the flexibility to focus on your studies as well. Um, Volunteer at a hospital. That's how I started my
Okay.
journey. Volunteering at a hospital. It teaches you medical terminology.
Right.
So healthcare administration, public health, it's very important that you learn the medical terminology, right? Especially in these environments, you'll be working with doctors, you'll be working with nurses, you'll be working with occupational therapists, you'll be working with physical therapists, all types of professions, DNPs, you name it. You'll be working with different types of healthcare professionals within that field. So it's very important that you educate yourself on medical terminology, and that's the way to go.
Right.
Also, um, go to seminars. I remember I was 19 and I was the youngest person at these seminars. Don't ever think that you don't belong somewhere.
We're gonna get into that
We're
more.
gonna get into that.
Don't ever think you don't feel like you don't belong somewhere. We're gonna get into that.
Okay. So yes, go to those seminars, join a webinar. There are cost efficient ways to do that. Sometimes places offer summer internships. One place I like to go, especially, is profellow.com.
Mm-hmm.
They're fully funded professional internships that you could join, especially as undergraduate students.
Mm-hmm.
There are fully funded master's degree programs as well. We were talking about that you could go into, and some master's degree offer you a stipend, so
Okay.
you won't be broke
Right.
as you're in school, and they pay for everything.
Right.
So it's very important that you educate yourself. School's not going to do everything for you, so it's important that you learn about different disciplines. Even today, me and Dr. Johnson, we're still going at it. We're still educating ourselves through the seminars, go into those spaces and talk to people.
Right.
Talk to people. Talk to people like who are like us, right? We have professionals on the chat. You can follow their pages, have a conversation, go out for a coffee with someone in that field, because that's the only way that you're going to get ahead. And that's what has helped me and Dr. Johnson.
I love that. Thank you so much. Earlier on, we shot a video. Didn't mean to use the S word. Moderators tap in. We executed a video on how you got into the public health space.
Right.
And I love that story. Could you just briefly share with them, how you got into that public health space and what your original plan was? Because remember, you guys, I always come on here and talk to you guys about pivoting your careers and not being afraid to change your major. And I did it about 3 times. She's done it a couple of times. And look, we're still successful. We're still graduates. So can you just shed a little bit of light on your experience as it relates to changing your major and just pivoting overall?
Right. Absolutely. So me originally, when I was even before undergrad, I wanted to become a physician. Honestly, I wanted to become an optometrist.
Okay.
And then it was either optometry or becoming a physician. So I started undergrad, went through, I was a molecular and cell biology major.
Okay, big science.
Yeah, big science. and life started life in. So when but I sick. I got sick in college, and honestly, I'll be honest with you guys, my grades weren't the best, right?
Okay.
So it was a very difficult journey, but me, I'm a fighter, so I pushed through. I got my degree. Okay, I got my degree, and I was looking at opportunities to continue my education, either going to study medicine overseas with a lower GPA, or stay like fighting through it, taking other classes and applying to the US. And one thing I didn't want to do is waste time, right? So I was like, maybe I could look at another pathway to my career. I have an extensive background in administration, and I loved healthcare. So I wanted to merge the two. And then in searching, I saw an opportunity for public health. And I was like, did public health find me, or I found public health?
Okay.
So I spoke to I spoke to my family, my parents, and then I said, you know what? Let me work a little bit, try to save, and then go and pursue a master's degree. Don't give up. I applied and I didn't get it. Okay. And what I did was I took some non-degree courses at a university close by, but I was still applying. I never gave up. My GRE wasn't the best. I told it, I didn't know how to study for the GRE. You're learning all these things. This is why mentorship is important. Talk to the people. And one thing I want to tell you is everybody has a story. So just because you see we shining bright, the sun wasn't always shining for us. Okay. Right. So what I did is I took some non-degree courses in a master's program, and then the university that I got accepted to called my name. So I went to that's how I met Dr. Johnson in no, we don't say the state, right?
Yeah, in
Florida.
Yeah.
I met Dr. Johnson in Florida, and then I started taking I joined the master's program, and I graduated from health promotion and disease prevention. And then after I moved on to get my doctorate, and that's how I met Dr. Johnson, and here we are today. And I fell in love with public health. I fell in love with the administrative side of healthcare and listening and working with populations and seeing the results is even more rewarding. So that's how I got into global health.
Right.
That's what interested me in that program. So don't be afraid to change your program, your path, and it will change your life, and it will change the life of others.
And don't be afraid to start over or have to start again.
Right.
Okay. First question says, how long did you take your PhD? How long did your PhD take? Mine took 2.5 years. Yours?
I went to school part time, so
Hmm.
it took me 4 years to complete
Okay, and I did mine. I was. Did they have full time with our doctoral program?
it. Yeah, that's why you finished in 2.5 years.
Oh, okay. I did mine.
That
I thought I
yeah.
was doing like two, 3 classes. I guess
Yeah, no. That's
that's
how long
considered
it's two and a
because
half to 3 years
the
is full
credits,
time.
the credits
Right.
were more.
Right.
So yeah,
Right.
mine was 2.5 years. But
Mhm.
she got accepted into the program before I did,
Mhm.
and so we met right after. And
Right
then I
after.
came into the doctoral program and just gun. Oh, some blaze. I came to the program blazing. On
Right.
here on TikTok, you gotta like be careful with the words you say.
Right.
I'm still learning. I came into our doctoral program blazing, and
Right.
then met her, and I was like, "Nah, you got to finish. Let's go.
Right.
We got to do this. Let's go."
I give a lot of credit to Dr. Johnson for why I finished on
And I don't know
time.
why she do, because I didn't do the work for you. You did it. You know.
I did the work, but you pushed me through.
Okay, but guess
Thank
what?
God, after God, it was you. I
Yeah.
always
So
tell people that.
sometimes
Give him his credit.
all you need is just a push. All you need
Right.
is somebody just to help you just
Get through it.
get through it.
Yeah.
But yes, to answer your question, Aaron, 2.5 years for me, and what you said, 3 years,
4 years.
4 year, 4 years for
Mm-hmm.
Dr. Lewis.
Yes.
Um, Tika, right? Tika. Oh, Tick Taker in the chat said, I'm getting my bachelor's in HIM. For those of you who don't know, HIM is Health Information Management.
Mm-hmm.
They said they're getting their bachelor's right now in HIM. I'm hoping to be done by next year. Do you have any tips? Um, Let me ask you something, Tick Taker. What do you want to stay within health information management? Do you want to stay within HIM? What kind of roles are you interested in getting? Because HIM is HIM falls under healthcare administration. It's a pathway of it, but it's very focused. So do you want to stick to HIM, or do you want to pivot into other careers within healthcare? What's your overall career goals? Let's start there. Because if you're asking for any tips and you're about to graduate on an HIM bachelor's degree, that means you just want to stay within, like, for example, do you only want to stay within healthcare informatics? Do you only want to, yes, I want to stick to HIM. Okay, where are you currently working in healthcare right now? Are you currently working in healthcare right now? If you are, what kind of work? Obviously, we don't say the name of our employers,
Mm-hmm.
but what kind of work are you doing? If you are working in healthcare right now, what kind of work are you doing? Okay, I see Dr. Lewis sharing the live.
Yes, I am.
Okay, you work in claims remotely. Do you know HCA Healthcare? Did you ever work at HCA Healthcare? Yeah,
I've heard of it.
I'm an advocate for HCA Healthcare. I worked there. I worked there for about 4 years, and I was cross trained in different departments, and it was a great experience for me. If I didn't get hired by the CDC, I would have stayed at HCA. But I know HCA is national. HCA is all over
Right.
the US.
Mm-hmm.
They have a large HIM department. I was at a level one trauma center, so I was a surgical coordinator. I started off as a surgical coordinator,
Mm-hmm.
um, but that was a good segue into the EHR analyst roles, EHR electronic health records analyst. So just as long as you said you're working with claims remotely, I'm sure you have data entry experience. Just make sure you're building up your data entry experience. Make sure you
Mm-hmm.
are building up your customer service experience. Make sure you're building up your experience on working remotely. A lot of these roles in HIM, they like for you to work remotely or have experience working remotely so that they can trust you. Hold on, I don't work with them. I work for a pharmacy company. Okay, no, I was just telling you about HCA because they have lots of roles within HIM that they are consistently hiring for. And when you actually go to their website, there's a section. Once you go to the careers, there's a section that says remote opportunities or remote jobs. So it's definitely something you can look into. Okay, I will look more into that. Yes. How far along are you? Did you say how far along you are in your HIM program? You'll be done by next year. Okay. Are you liking where you're at right now, or do you want a new job somewhere else? Oh, you should be done by next May. Okay, good. Congrats to that. Yeah,
Congratulations.
make sure. And question: do you have any plans after your bachelor's degree? What do you want to do after your bachelor's degree? And I haven't seen you on here, so welcome. I'm Dr. Anthony Johnson. I'm glad you found my page. I'm glad you are here. Nice Breeze, thank you so much for liking the live. I do want a new job somewhere. Do you like working remotely or do you want to work within an organization on sites? Okay, and I guess so. You picked a good live to be asking these questions because you
Mm-hmm.
guys two subject matter experts. I like this. I had a couple of questions, but it looks like y'all got questions for us. I am new, and yes, I do like working remotely.
Good.
Also, check out Centene Corporation. I know somebody that recently got hired within their data entry, doing data entry work with Centene, Centene Corporation. Yes, I did. I'm glad I found this live. No problem, Tick Taker. Centene Corporation and HCA Healthcare. How do I chat on my thing? Go open your live.
Mm-hmm.
I'm gonna drop the two names in the chat on her on Dr. Lewis's page. Okay.
Okay.
You can do
Uh,
it? Yeah,
okay,
big
go ahead.
caps. That's one. HCA Healthcare. The next one. Centene Corporation. Perfect. Thank you, moderator. HCA Healthcare and Centene Corporation. Perfect. Thank you so much. Moderators are tapping in. For those of you just joining in, welcome on into Office Hours with Dr. Johnson. This was an impromptu office hours. I go live every Tuesday, but today one of my colleagues was in town, so I said, let's link up. We were shooting content earlier on, but I said, let's link up and join the live and just, continue to come. We were having a healthy conversation off
Right.
camera. So I
Right.
said, no, we got to continue this conversation here with my community. Thank you so much, moderator, for pinning the live. Centene Corporation and HCA Healthcare. Check those two out if you want opportunities relating to data entry. They even have remote patient schedulers. They even have remote claims adjusters. And you said you already work with claims. They even have remote what do they call them now? It's not patient. It's like patient service representatives
Mm-hmm.
or patient financial advisors.
Advisors,
All of
right?
those roles are can be done remotely, and that's all good experience if you want to stay within HIM. Once again, HIM is Health Information Management. So thank you for your question. I want to continue. No problem, Tick Taker. No problem. I just want to make sure I'm not missing any questions before we continue. I wish I could just work remotely only. Can't don't you?
Mm-hmm.
But we can.
We can. Not yet.
Next topic of discussion was I feel as though it's an important topic, and even though if I've already spoken about it, I want to make sure I keep speaking about it, and I have somebody with me here who can speak about it, who would stress it even more. Imposter syndrome,
Mm.
and she's looking at me like that because she's recently experienced that. I've recently gone through that, and we had to call each other and vent about certain situations.
Mm-hmm.
Imposter syndrome, okay,
Mm-hmm.
okay. But first, I think she wants to share with you guys the definition.
Yes.
You see,
So,
you see this?
like
She,
minds.
a professor, even outside of work, a professor. Drop with them the definition. Let me come out of the camera altogether. Share them the definition. This is your office hours. Office hours with Dr. Lewis. What's up?
With Dr. Lewis. So, what is imposter syndrome? It's a psychological experience that causes people to doubt their own skills and experiences and their successes.
Repeat that again. Wait, hold on. There's this new trend where somebody is in the front of them and the person is in the back of them and saying, "Hey, my friend is selling this," or "My friend is talking about this." So I'm repeat that again. My friend wants to share the imposter syndrome. Repeat it again, and y'all better listen to Dr. Lewis. Go ahead, go.
It's a psychological experience that causes people to doubt their skills and successes.
Okay.
Yeah.
Okay.
Feeling inadequate.
Okay. Thank you so much for sharing that. In the chat, they're saying I go through that all the time. Mandy, guess what? A lot of us do. Even us that have big degrees and even us that have all these jobs, a lot of us still do.
Right.
So don't feel like you're alone. And guess what? It comes and goes for me. If I'm being honest, if I'm being transparent,
Right.
it comes and goes for me, depending on the situation, depending on the situation.
Right.
Yeah.
Right. Yeah.
When last, obviously, share what you feel comfortable sharing. But when last did you feel imposter syndrome, or that you weren't good enough, or you weren't enough? And I want to see if you're gonna share that story that you recently called me about, or if you're gonna say something else. But go ahead.
story.
The remember at school in the staff meeting and all them people.
Yes, that's the one I was going to share.
Okay.
Okay, so there was one time we were in a staff meeting, and I was pretty new to the university, and I was in the middle of a whole bunch of I'm in the middle of other professionals who we are all successful,
Right.
and also being the youngest one there.
Okay.
That's another thing.
Okay.
These people are more seasoned, more experienced, and more advanced as it relates to academia and as it relates to just being in the field of public health and healthcare alone. And after I said something, and then I was like, should I have said it like that? And I hung up it was a Zoom meeting, and I bursted out in tears. I bursted out in tears, and I called my sister, and I was like, I don't know if I'm made for this. Like, am I eligible? Like, am I qualified enough to be in these spaces? And it took me a while to be like, and my sister was like, you're as educated as they are.
Right.
You're more than qualified to be there. And that's important to have people around you.
When I called you about my grievance, that's the same thing you told me.
Yes.
Oh,
we encourage each other.
Yeah, sorry to cut you off.
No, that's good that you said that. It's important to surround yourself with positive people.
Right.
Sometimes it may be family, sometimes it may not be family. Okay. Sometimes it may be, this church mother that you grew up with. Sometimes it may be a colleague at work. So it could be anyone. But
a student.
Yeah.
A student.
Right.
Okay.
Right. So it's very important that, and that's why never feel that you're inadequate. Never feel like you don't belong here. I experienced this when I go to these conferences. I went to a conference a couple of months ago, and let me tell you, I have to be real. Racism is real. Okay, it still exists.
Okay.
And people would say mean things like, "I'm surprised your job got you over there." I don't know if I was supposed to say that on live.
That's all right.
But it's reality. It's reality. So I always tell people, you were made for this. And one thing you have to always remind yourself, like I said earlier, is that you everyone has a story, right? Don't think because you're having financial issues that person didn't have financial issues,
right?
Or you're struggling with a class, and you're the situation that you are in doesn't define who you are, right? We may go through a tough patch in life. That's life. Life is going to do that to you. Life is going to throw all types of things at you. But when life throws you lemons, you make lemonade. Right. Okay? So you make the best out of every situation.
I love that. Thank you for sharing that.
No problem.
One situation that I do want to share with you all where I felt as though, damn, the student came to me and was like, "You're the professor? You are younger than me. How old are you?"
Right.
He was 8 years my senior, so he was older than me. In that moment, he was right.
Right.
But I had to remind myself, I walked away from that and I had to remind myself, I'm qualified.
Right.
I have my doctorate degree. I have years of experience in healthcare.
Years of experience. Yep.
Okay, so it's like I had to sit back and be like, is he projecting whatever he was feeling and he just said it out loud to me? You know? Yes. How old are you? You're the professor? Yeah. Yeah.
And one thing I want to add, sometimes people say things that have nothing to do with you.
Okay.
They're going through their own things in life, and they just need someone to throw their frustration at, and they just say mean things. So, So never think that you're a problem. You're not the problem.
Right.
Unless you become the problem.
Unless you become the problem, right.
Because there's that too.
Yeah, Aaron said, I can't believe he would say that. Yes, he definitely did say that. And Aaron in the chat, he also dropped, imposter syndrome causes people to doubt their skills and abilities, feeling like you don't belong. Thank you for sharing that definition.
Thank you for sharing that. Yep.
But yeah, he said that to me. I just had to keep going, like I just had to keep going. And to this day, they would say things like that to me and then try to find my social media and keep up with me. I thought I wasn't good enough.
Listen.
I thought I wasn't good enough.
You thought.
Okay.
That's not the case. Obviously.
Right. One more thing.
Yep.
How do you juggle um, going to school and going to work full time? How did you juggle it? Because on here in my community,
Mhm.
we have a lot of people who are interested in going back to school,
Right.
but they have life.
Right.
How did you juggle it, or what could you share with them to kind of um, say, hey, you can do it too?
Yeah. Write things down.
Mm,
Use a calendar. Oh, if someone knows how to write things down, it's Dr. Johnson.
mm-hmm.
Use a calendar. If you don't, some people don't like using
Right.
the phone calendar.
The phone calendar.
We're living in a very digital age, so the phone calendar is amazing.
Right.
If you look at my calendar, my sister always says, "Oh my gosh, your calendar makes my head spin."
Mm-hmm.
But I do a color system, which I learned from my
bring it closer.
yes, I do a color coding system, which I learned from my own boss, my old boss.
Well, it looks like the computer's at work.
Yeah, yeah. So I use a color system. So blue means anything work related. Orange is anything.
I like this.
First, hold on. What is orange? It's spiritual things. Okay, prayer and all that stuff. Um, uh, blue. Purple is travel. Red is things that are urgent. So use a color system. Okay. You could use a planner. You could use a planner, but whatever you use, Google Keep is a good thing.
Okay.
Google Keep is a good thing. I use it to keep my checklist. I use it for my checklist, whether it's groceries, etc., etc. So that's Google Keep. Don't hold it too long. My personal business stuff are on there. Yeah. So write everything down. How do I find the balance? So if you're going to school remote, you just have to discipline yourself, especially when it's self-paced. You have to discipline yourself. Okay. If it's live, it's more structured, etc. You still have to discipline yourself because I mean, you could be like, "Oh, I won't go to class today."
Right.
We have those moments when
right.
we don't want to go to class.
All of
right?
us do. It happens.
Stay focused on your goals. Stay focused on your goals and find community. Like Dr. Johnson and I, we were meeting together. We met up multiple times over Zoom. We had phone calls. He was supporting me. I was supporting him during those times. And you go to work. And the other thing too, try to acquire many skills. Like don't do your job, but not only routinely. Like find things to learn, do things differently that are in line within the vision and mission of the job, of course. But try to find that balance and take care of yourself. Because if you don't take care of yourself, no one's gonna do it for you.
No one's gonna do it for you.
No one's gonna do it for you. Stay hydrated. And go to the library. Like that's something I thought. Yeah, you always say go to a coffee shop.
Go to a coffee shop. Go to a library. Go to your local school, the campus that you were an alumni of.
Right. Because
Mandy said keep it fresh. Definitely.
Yeah, yeah, and sometimes some of you may have children. So the noisy. Listen, I have family members. I have a big family. It's always noisy, and they all know that. I would leave the house, and you get more concentration like that. You go to a public library, go to the school library, go to a coffee shop that's not too noisy, and do what you need to do. Before you know it, in the blink of an eye, you will be great. It's been 3 years since we graduated.
It's been 3 years. We graduated our doctoral program.
Feels like yesterday.
2022.
Yeah.
August 2022 was our graduation ceremony.
Yep.
But I was done June 2022. When were you done?
I was August.
June? Oh, August?
August, yeah.
Oh, yeah.
Yeah.
Because remember?
Yeah. I was done August 2022.
Wow, I remember that.
Yeah. And guess what?
And I told you. Remember? Sorry, y'all.
But what does that tell you? That tells you time goes by quick.
It does.
That means it's been 7 years since I started my doctoral program. And it's been 5 years since, 5.5 years since you started your doctoral program. Yeah, I started my doctoral program
in 2020 in the height of COVID.
Yes. So that tells you that you're like, oh, I'll take a break. I'll start next year. But listen, if we took a break and started next year, that would be 7 years down the line. Yeah. We would still be taking a break. Yeah. So do what you need to do while you can do it
I think that's why Aaron asks, how long did it take us? Because whenever people say, oh, doctorate program and doctoral program, 6 years, 5 years, 8 years, our school gave us 7 years to complete the program. So that was the time frame that we had. I did it in 2.5. She did it in 4.
You know what has helped me?
What?
In every program that we've been in school.
Mm-hmm.
You know what has helped me? Just plan your graduation from the day you start the program.
Yup.
You stay focused on your graduation. You're like, oh, when I'm graduating, I'm
I
going
need
to go
to-
Switzerland.
Right.
You're going to be like, this is how many people I want to invite. As you're talking like that, you're motivating yourself. You're like, and then you see the time goes by faster because you're focused on the final day.
Right. And keep in mind, remember, for me, I wanted to graduate before I was 30. So I just wanted to make sure I was done before that 30-year-old mark.
Mm-hmm.
I gave myself a timeline.
Mm-hmm.
Let me scroll up in the chat. Mandy said sometimes a change of scenery can help. It definitely does.
Yes, it does.
We changed up scenery here.
Mm-hmm.
We did. She flew from New York and came to Florida.
Right. And you're going to fly from Florida to go to New York.
Yeah.
So
okay. I didn't know what you was about to say.
So we could go to Broadway.
I didn't know what you was about to say. I was going to be like, Aaron said, I kind of want a doctorate, but they expect you to not work. Aaron, no.
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 We ain't doing it.
Aaron, you got to work. How you going to pay your bills? How you going to take care of yourself? You got to work. That's why the doctoral program is so long for some people, because they have to maintain a full-time job. Mm-hmm. And it's hard for some people with certain full-time jobs to be in school full-time.
It all depends on the type of program he's into. If there's a specific
Aaron
program that you want to go into.
He's in healthcare finance. I'm not sure what kind of doctoral program he would be interested in. But health finance, a lot of those jobs can be done remotely. So if you want to find yourself a remote job and then go to school full-time for your doctoral program, go right ahead. I support that.
And find a job that pays your school for you.
Find a job that will give you tuition reimbursement or tuition waiver. Keep in mind there's a difference between tuition waiver and there's a difference between tuition reimbursement. Tuition reimbursement is you pay it up front by any means necessary, either through loan, through your personal money, or through grants by financial aid. Or a tuition waiver is when the school or the organization or institution pays for it completely, and you don't have to worry about any finance paying any portion of it up front. The school just waives it for you. So just know there's a difference. Tuition waiver, tuition reimbursement. I think I've shared that with you guys before.
And fully funded programs.
And funded programs with a stipend.
Right. I talked about profellow.com. Listen, they're not paying me to tell you this information, but I tell everybody.
Let's drop it. Put it in the chat, please.
Yeah, profellow.com. Just create an account.
People are trying to co-host? No, I'm good.
Just create an account. It's absolutely free. And what you can do is you could find fully funded programs. Some programs, they have master's programs, they have doctorate programs, and some programs even come with a stipend. So you won't be broke while you're in school. Okay?
Oh, Aaron said that he already works from home. Oh, Aaron, please. Finish your program that you're doing now, and when it's time to do your doctoral program, jump on it. You can definitely do it. If you're already working from home, that means you can set your own schedule when it comes to completing your work. Okay?
Yeah.
I see you, man. You're dropping the diamonds in the chat.
What I love about the people, I mean, your TikTok students is that they're motivated. Yeah. They're motivated to get ahead in life, and we love that. And congratulations to all of you.
Yeah, my supporters, and my community is very motivated.
Right.
And what I appreciate with them is they always want to learn and always open to receiving information and me, like I always say, dropping gems.
Right.
You know.
Yep.
So that like I say, even though some of them may not be in healthcare, or some of them may not be a professor or interested in being a professor, or interested in higher education, they are still wanting the information or just wanting to learn, because hey, you could always be a learner. I like to consider myself a lifelong learner.
Right.
You could always learn something. So that's what I appreciate so much about my community and my supporters overall.
And we tell our students all the time,
in
learning
person,
is lifelong.
Lifelong.
Because life is changing constantly, and new things are coming up. That's why it's important, like continuing education. I know you talk about that in your courses.
Okay.
Continuing education is to keep up with what's going on.
Right.
You don't want to get into a space and you don't know what the latest data is in your field, and you're just looking at everybody like they have 9 heads.
Like
That's why you want to stay updated.
I
Do your
recently
own research. Yeah.
I recently had a meeting with an associate dean, and one of the questions we were just discussing was, how do you stay on top of current healthcare trends? So even now we're still being asked that. How do you stay on top of healthcare trends?
Reading, watching the news,
And I told him
articles,
going to conferences,
going to conferences,
and networking.
Right. Oh, that's big.
Big.
Yeah. And the good thing with these conferences is they always have networking events within the conference.
Right.
So you get a 2-in-1.
Right.
And if you work for a university, if you work for a hospital, sometimes they have grants that you could apply for that will cover all those expenses, whether it's lodging, whether it's transportation, for your food, everything. They just cover it all. So look for those opportunities in your workplaces as well.
Right.
So they do have budgets for that. I wanted to say something else about conferences.
Sure.
Don't always stick to what you're studying. It's good to learn other disciplines within healthcare. When we started the live, I did talk about I forget. I did talk about learning medical terminology.
Okay. Right.
The last conference that I went to was on traumatic brain injury. So I was learning. That's totally out of my scope of out of my area of expertise, but because I'm doing research on TBI, I went to a TBI conference. Most of the sessions were all medical. Most of the sessions were huge medical terms that I've never heard in my life. It was like a different language on a different planet. So I was happy that I took tons of notes. I was happy that I learned all of that to understand the work that I did in research. So it's important to learn different disciplines. So don't always go to stick to the complete public health, because public health is so broad.
It is.
But the more you can learn, the better it will be for you.
It is.
Yeah.
Definitely. Thank you for sharing that. What advice would you say to someone who's interested in public health or interested in healthcare administration overall, but they see how the field is being affected by our current administration?
There's always work to do. There's always going to be work to do. If you don't want to work in the United States, honey, there are public health opportunities all over the world. After I graduated with my master's in public health, I was applying to jobs in Japan. I was applying to jobs in Haiti. I was applying to jobs in Chile. I went to Chile for some time to teach English.
You did?
Yes, I did.
You know, I want to go to
You learned something about me today.
I want to tell you.
Okay, yeah, there are so many opportunities, and the good thing is that you could learn another language.
Okay.
Learn another language. But with the field of public health, especially in today's climate, you don't have to worry about today's climate.
Okay.
Because there's opportunities will arise from today's climate in public health. So just be on the lookout, and the outlook of public health careers is growing. Right now the salaries are getting better, and this is why going back to school is important, right? So you are not only diversifying your portfolio, but you're also acquiring skills, and you always talk about transferable skills. Nothing gets lost. Nothing gets lost. I can tell you, my career started in church. Okay. Helping in the office. That's how it started. Okay. So nothing gets lost. Nothing ever goes to waste. Never feel like the path that you took, you can't do anything with it. Listen, I was working at a computer lab when I was in college. Do you know how many technical problems I face at work in a day?
I'm surprised.
I'm still using those tech skills now at the university.
Right. I'm surprised you didn't do healthcare IT. Miss Lovejoy, thank you so much for helping us achieve our goal. Welcome into Office Hours with Dr. Johnson. This is an impromptu office hours. I normally go live Tuesdays at 7 p.m. But one of my colleagues flew in town, so I said, hey, we have to hop on a live together. Thank you, Jess, so much for the rose. And thank you so much, Miss Love Jade, for grabbing your daily heart me and supporting the goal overall. Today, we're just talking to Dr. Kherveleen Lewis. She is a public health subject matter expert. We're discussing a variety of topics. What were you just saying that in college you're working? Where in college?
I was working in a computer lab.
Okay.
Yes, I spent 5 years working in a computer lab at my alma mater in undergrad. That's my sister. Hi, sister. I spent 5 years working in computer labs in my alma mater undergrad, and I was learning different how to troubleshoot.
Okay.
How to reboot computers, how to fix just little technical problems in the computer lab, and I tell you, till today, I'm still using them at
Those
the
same
universities.
skills.
And how long ago was that? Almost 20 years ago.
Oh, damn, you weren't playing it.
Oh,
Okay.
sorry.
Wow, that was a long time ago. Yeah, it's very different to normally I don't host my office hour sessions with somebody in person with me. So
Don't calculate.
yeah, it's impromptu today. You guys know I have a meeting agenda.
Yeah.
We have segment 1 where we do trending topics in healthcare, and then segment 2 is the interview, and then segment 3 is Professor Tips.
Okay.
Today, Dr. Kherveleen Lewis flew in, so I just had to bring her on to my office hours to drop some gems, because over here in office hours with Dr. Johnson, we like to drop gems.
Right.
Even if it's informal, it's still informative. One of my moderators in the chat, can you please drop that? Informal but still informative.
Right. Hi, Jess.
Hey Jess, how you doing? Good afternoon. Thank you for grabbing your daily heart, or thank you for sending the rose, I think. Hi guys, this is so important. I'm glad you guys are doing this information session. Thank you so much, Jess. Guess what? We were literally having this conversation on here, and I said, good to see you. Oh, good to see you too, Jess. Did I meet Jess when I was taking my graduation photos, or was that a different sister?
Oh, that was the sister.
Oh, that was Jess with the low
Jess.
haircut?
Yup.
Jess, okay. Sak gen la, Jess. Sak gen la. I know you, Jess. I know.
Yo, you need to play some compa for Jess. She's
Dr.
a compa dancer.
Dr. Lewis has a whole bunch of siblings like myself, so I didn't know which one I was speaking to, but Jess, sak gen la.
We were playing compa earlier and you missed it, but we'll play some for you at the end.
Thank you, moderator. Informal, but still informative.
Right.
I want to keep the conversation going.
Yes.
What would you say? Hold on. They're asking me to confirm that we're still on live. It's been an hour. 1 second.
Oh, wow.
You see that?
Flies.
And I'm glad you're seeing this. So when it's time for you to start getting active, you can get comfortable. You guys, another reason why I brought Dr. Lewis on here is we're shooting content today to start her page. She wants to have a page on public health. She wants to have a page regarding student mentorship. She wants to have a page regarding trending topics in healthcare, a variety of topics as it relates to public health and healthcare administration from her perspective, from her acquired skills and acquired professional experiences. So that's another reason why I brought her on here, just so she could familiarize herself. I see your sister laughing in the chat. So Dr. Lewis can familiarize herself with thank you for the follow, with going live on TikTok and just, being a TikToker, because this is very different. I've been on here for months now.
Right.
I still don't understand it. Thank God for my moderators. I'm on here and they tell me certain things to do. I don't know. I can just come on here and just yap.
You have good people working with you.
Yeah. I have a group of moderators. Thank you so much. So let's continue the conversation. What would you say is the difference between public health and healthcare administration?
Okay, so public health mostly focuses on improving healthcare outcomes in target populations.
Okay.
So it's all about improving the quality of life. How do they go about that? At the beginning, we talked about how I work in the nonprofit sector, working on different mission trips, for example, providing medical resources, providing educational resources, educating the people. So in the past, I've been a healthcare educator.
Okay.
And we look at the need. We do needs assessments where we see what issues are in the community.
Okay.
Right. So what healthcare issues are within that different types of communities, whether it's locally or overseas.
Okay.
And that.
Pause before you continue, because you said a keyword, needs assessments.
Right.
Can you just what's a needs assessment? I know what that is, but the people what's a needs assessment?
Needs assessment is when you either you could create a tool, and what you do is you gather information to see what are the needs of the people that you are going to serve. Okay, so for example, let's say you want to do a healthcare. Let's say you want to do a healthcare fair, for example, right? You go into a community that has high levels of diabetes within the population.
Right.
Okay.
Right.
So what are we looking at? Do they have healthy produce available for the people to go to a particular supermarket that provides those fresh produce that they need? That's one thing. The other thing is, are there sidewalks? Okay, so how do the people exercise?
Okay.
So you're taking a look at all these things, and when you see what the people need, you then gather this information to create certain interventions, right? Like so you would do a healthcare fair, that would be a start, where you would bring out vendors, different healthcare providers in the community. They get acquainted with the different resources that they have in the community, and then you say, we're going to add to it, right? So they say, let's partner with a construction company or an engineer that will allow us to build sidewalks in that community. Maybe we need to work on prevention measures. So there's primary prevention. We all know there's 3 types of prevention, right?
What are they?
So there's primary prevention, secondary prevention, tertiary prevention.
Perfect.
Primary.
Repeat that again.
Primary prevention, secondary prevention, tertiary prevention. What is primary prevention, right? So we're looking at our needs assessment, we're gathering our data. We look at what is the first way to prevent diabetes from continuing within that community. Oh man, we don't have any playgrounds. So the students and the children in that community are not being active in the first place, right? So how do we increase physical activity in that location? So that's primary prevention. We look at secondary prevention measures. Individuals are, let's say they're experiencing symptoms, but they don't know whether or not they have the disease. These are where the healthcare fairs come in, right? So you employ doctors, you get vendors, and then you start taking. Let's start testing. Let's start testing them for diabetes, right? So they bring in the I believe it's glucose monitors, right? They bring in the glucose monitors, and they see how many people in the area actually have diabetes. Now, what do we need to do? We need to partner up with some businesses to see how many grocery stores we might need in the area. So that's how they create these interventions, and then over time you will see a decline in diabetes. What is tertiary prevention? Tertiary.
Y'all are in class. I hope y'all are taking notes.
Tertiary prevention is when they already have been diagnosed with the illness, and they're trying to find ways to either cope with it or reverse it. Right. So adapting healthy habits. They are eating well. Now there's supermarkets in the area. It's not only McDonald's. It's not only Wendy's. Okay, and we protest for these things to get out of our communities, right? So when you have and this is why healthcare is collaborative, right?
Repeat that again. Moderators in the chat, can we drop healthcare is collaborative?
Healthcare is collaborative. Good
evening, Dr. Dina. Thank you for joining. This is an impromptu office hours with Dr. Johnson. I have one of my colleagues here, Dr. Kherveleen Lewis. She is a public health subject matter expert. So healthcare is collaborative also.
Healthcare.
Thank you so much, Mandy. Office hours with Dr. Johnson and Dr. Lewis. Informal but still informative. Thank you so much. Dr. Dina, how are you doing?
Hi. I'm wondering if that's my sister. Is this
No, this is somebody else. This is somebody else, one of my friends who I've met on TikTok.
Oh, okay. Yeah. Hello, Dr. Dina.
Yes.
So healthcare is interdisciplinary, right? It's not a one-man show.
No.
And I tell my students that all the time.
No.
Healthcare is not a one-man show.
No.
So it's very important that businesses, mayor's offices, federal offices, local offices, they work together, nonprofits, you name it. Right? All these healthcare lawyers. We need lawyers on that board, okay? Because in working in the nonprofit sector, and I was telling Dr. Johnson that I had noticed how important the law is. When you're helping people, when you're helping other populations, it's important you have someone backing you up with the law to know what their benefits are,
Exactly.
what laws protect them, and what
making
laws
sure-
protect you.
And making sure we're maintaining compliance.
Right, you're in compliance.
In compliance.
Right,
Okay?
right.
Okay. So healthcare is collaborative. Thank you, Aaron. Healthcare is collaborative. Another example, whenever I'm teaching certain subjects or if I'm coming on here on live, I've called Dr. Lewis a couple of times and was like, hey, I'm going to be discussing this, and this, and this. I want to pick your public health brain. And she shared with me some ideas, and she's even shared with me certain tones on how to address certain topics.
Right.
Remember, I'm coming from a healthcare administration perspective. I still needed to tap in with her public health perspective. Once again, healthcare is collaborative.
And interdisciplinary.
I don't say that word too often because my tongue is heavy sometimes and it's a tongue twister. But healthcare is interdisciplinary.
Even us as doctors, we need help sometimes.
Okay.
Interdisciplinary.
Okay?
Got it.
Healthcare is collaborative. Just know. We collab in healthcare. We collaborate in healthcare. Okay?
Right.
Another topic that I want to talk about that's a very important topic. Best practices for mental health. From one professor to another professor, from one doctor to another doctor.
Right.
What do you do to stay on top of your mental health? You shared it before, but I want you to share it again. Thank you, chat. Thank you, moderator Aaron. Let me pin that. I like how you did that. Healthcare is
interdisciplinary. Jesse should help us out. This girl's a reader.
Okay.
Interdisciplinary.
Healthcare is interdisciplinary.
Right.
Okay. Let's pivot into another topic.
Yep.
Best practices for mental health. How do you number one? How do you de-stress from work? I know your job can be taxing on you.
Yeah.
I know your job can be draining.
Right.
It can be emotional at times too.
Yeah.
Jess, don't laugh at me. Don't laugh at me, Jess.
She's a reader, so she.
My sister, I have a sister too who's a reader too, and she's big and always trying to put it like.
Yeah.
I know what it is with that sister I'm thinking about. Her accent is not strong like my accent, so that's another reason why I can't say certain words too, because it's like my accent is it comes and goes.
You got it.
On certain words, but interdisciplinary. Healthcare. Wait.
Laughing at you,
Healthcare is interdisciplinary.
You got it.
Okay.
You got it.
Best practices in mental health. Thank you, Mandy. Okay, we're switching gears.
Right.
What do you do to de-stress?
I call Dr. Johnson to de-stress. I fly to Florida to de-stress.
Okay.
Okay. But on a more serious note, but that is one. On a more serious note, trying to find that balance in life, right? Sometimes you just need to disconnect from the work, right? Close that laptop, put that phone to the side, and go and take a nap. Okay. The other thing, do things that you like. Get a hobby and do things that you enjoy.
Right.
Because if you're not enjoying life, there's no point, right?
No point.
You have to enjoy life. Taking one day at a time, building community, connecting with your community. I also called Jessie when I was facing imposter syndrome. She could tell you. I called her and she was the one that was like, "You're overqualified for this," right? So sometimes
she's dancing in the chat.
Right. Yeah, it's so true. Like she knows. Sometimes you need that community to really push you through, right? Other thing, you just have to find that balance. I said this earlier, don't let your situation define who you are.
Repeat that again.
Don't let your situation define who you are, and always know that you belong in that space, right? Don't look at what you look like. Don't look at, they're more qualified than me. Everyone has a story. I will repeat that, and I will repeat that over and over again. Everyone has a story. They won't tell you their story, but everyone has a story. Don't think it's easy. Life is not easy.
Life is not easy.
Yeah. So take it one day at a time. And use the resources on campus.
Pause. Your sister says she loves to dance. Dr. Kirby knows this. A good
Yeah.
hobby.
Oh, I told you she's a dance. You have to put compa for her later. Okay.
Okay.
So
you're about to say something important. Campus resources. I want you to tap into that.
Listen, you pay for them. One thing I remind the student, I always say my students are my
babies.
No, my students are my employers. Because if they're not there, who's gonna pay me?
I like that.
My students are my employers.
Did you guys hear that? Not the institution that she teaches at. Her students are her employers, because without no students, how do you do your job? I know it's crazy. My department chair called me 2 days ago and was like, Dr. J, student enrollment is
Yeah.
stressing.
Right. Yeah. And I tell them, my students are my employers. That's why I always encourage them to ask me any question that you want. Right? I was like, you pay me to be here, okay? And utilize those resources on campus. You're struggling with APA. There's a writing center.
Right. You're struggling with mental health. There's a center.
There's the counseling and psychological services
center. Yeah.
Right. You're struggling. You're struggling financially. There is a pantry on campus. Don't be embarrassed to use it.
There's a food pantry and a clothes pantry. Not all. Sorry to cut you off, but not all schools participate in it. But most of them are starting to pick up on it. There's a food pantry and there's a clothes pantry.
Right.
Continue.
Right.
I want to make sure we're emphasizing certain resources, because I know there's a lot of people on here who are deciding to go back to school and kind of,
Yeah.
There's a food pantry and there's a clothes pantry.
Right. There's food pantry, there's clothes pantry. There are social workers on campus that you could have a conversation with. Some students, if they do not have parental support, or if they filed independently, are eligible for state benefits. Go and see your advisors. Go and see the medical center on campus. You're having a stomach ache, go to the medical center.
Right.
Let me tell you, your tuition is paid for.
Utilize your resources. Welcome on in, Governor. This is just an impromptu office hours with Dr. Johnson.
Yes.
One of my colleagues flew in town, so I said, let me bring them on. So continue the conversation that we were having off live, on live, because we are always dropping gems and we're always saying how healthcare is collaborative. So we're showing you how healthcare is collaborative. I'm a healthcare administration subject matter expert. She's a public health subject matter expert. And we're just discussing various topics as it relates to higher education, as it relates to mental health, as it relates to various topics in healthcare when it comes to your degree or when it comes to you pivoting your careers.
Right.
Healthcare is collaborative. Welcome on in. Let's get back to utilizing your resources on campus that the students are already paying for. And I want you to emphasize how you just said that your students are your employers.
My students are my employers.
Not the school.
No.
Why?
Because if they're not in front of me for me to educate them, I don't have a job.
Right.
I don't have a job.
Right.
The other thing too, go to your professors.
Right.
Tell them what's going on.
Set up your office hours.
We call them student hours. Set up the student hours.
Okay.
Because they're your hours.
Okay, and I want you guys to know what we're doing here, this office hours, this is real.
Yeah.
Colleges do this in real life.
Yes.
Where you set an appointment with your professor and go to their office hours.
We call them student hours.
Yeah, some places call them student hours, some places call them office hours. This is a real thing. This is where I got the idea from me doing office hours with my real students.
Right.
Continue.
Right. Set up a time to meet with. You're struggling. Set up a time to meet with us.
Right.
Professors usually help students who really take the time to speak to them.
Right. Right.
And that's the difference between a student who passes and a student who doesn't pass.
Because if I see you struggling, but you come to my office hours maybe 2 or 3 times for the week, I'm going to pass you.
Yeah.
Not saying I'm going to give you an A+ or an A.
Right.
I'm going to make sure you pass my class.
Yes.
Because,
Go ahead.
Because I can.
Yeah, exactly.
You know?
Exactly.
I see the effort.
You see the effort, and also there are accommodations that we can make for certain students who come and see us.
Exactly.
Okay? We don't advertise them,
no,
but certain professors will make accommodations for you.
Just like how we have to make accommodations for the student athletes who the school says to me, hey, make sure you pass student A, B, and C because they're on such and such an athletic team. Well, us as professors, we make sure that the students we see that are struggling, who are making the effort to come meet with us and express their grievances and say, hey, I need you to explain this again, or hey, I'm having trouble with this. I'm going to make sure I advocate for you.
Yes. I want to mention something else that's important. The Office of Accessibility, right?
What is that?
The Office of Accessibility are some students who need certain accommodations, right? Especially during exam time. Let's say you're in a room, and I'll let you guys know. Let's say you're in the classroom and you can't focus when there's a lot of people around. Right? I give in-person tests. I'm old school. Pencil and pen and paper. Yeah.
And you grade it.
I grade it. I use my red pen.
Pause for a minute. Pause before we continue because someone asked an important question. Mandy said, even if they're an online student, you're paying that tuition. You are paying that tuition.
You are paying that tuition.
So the same resources and services as an in-person student has, online students have it as well too. Okay. Yep. Once again, you are paying that tuition.
Yep.
Dr. Kimberly Douglas, you just jumped back in at a perfect time. We're talking about students making sure that they are utilizing the campus resources. And Mandy just posed the question that does online students receive the same resources as in-person students? And I'm telling her, you pay that tuition, so you have access to those same services and those same resources. You were just discussing student accessibility. Continue.
Yes, Office of the Student Accessibility are for students who need certain accommodations. So I gave the example of test taking. Me, I'm old school. I use paper and pen. But some students, they feel too anxious when they're around a big crowd of people. Right. So we were talking about mental health earlier. Right. So how you go to the office and you fill out the necessary paperwork. And they will accommodate you.
They definitely will.
There are students that I had to accommodate via Zoom because they couldn't be in the classroom for whatever reason.
For whatever health reason But pause on that real quick. One thing I do want to shed light on that's very important that my real students at my school were having concerns about when they utilize the student accessibility office services, they had concerns that it would show up on their degree. Right. No.
Why would that? Business.
And if you're some of them weren't in healthcare, so they wouldn't know. But that's violating your HIPAA.
Right. That's violating your.
That's
HIPAA
violating HIPAA laws.
Right.
So if you are receiving services, thank you so much for joining on in. Impromptu office hours with Dr. Johnson. I have one of my colleagues here, Dr. Kherveleen Lewis, public health subject matter expert. If you are utilizing the student accessibility office's services. No, they're not going to put on your degree that you have unique abilities.
They'll be fired in a heartbeat.
Right. No, they're not going to put on your degree that you needed additional time to take a test.
Right.
Fired.
We'll be fired in a heartbeat.
No, they're not going to put on your degree that they gave you an additional days to take your exam or additional time to submit your reports or major projects.
None of that.
No, if you had a miscarriage and you are suffering extreme health issues and you have to continue taking the course online and not come to class in person and you have to utilize the resources from accessibility, no, that's not going to be on your degree. What's going to be on your degree? Your name, the date you graduated, and your major, and telling you congratulations. Dr. Kimberly Lewis said the faculty member just needs to know the accommodation exactly. And you know what? Also, I want to touch on that. I want to dig more deep into that. When the accommodation office contacts me, the student's name is not even on the email. It's the ID number. So I physically have to go into my roster and match the ID number with the ID number. That's how serious, and that's how I say patient protection, but it's student protection that they are. So once again, when you access accommodation services, that does not show up on your degrees. I'm making sure I scream that on here because I scream it to my students in real life. They've claimed to me and told me, FERPA, Okay, subject matter experts, Dr. Kimberly Lewis.
Right.
They come to me numerous times, Dr. Johnson. I don't want to go because I don't want to show that on my. I don't want that to show up on my transcripts or my degree. I grab my head like this. I'm like, why would it?
Right. Right.
Why would it? That's violating your privacy as a student,
Right.
and you're violating your privacy as a patient. Because keep in mind, I'm coming from the healthcare side and also the professor side. So HIPAA and FERPA, please. So I just want to make sure I say that again. Accommodation services does not show up on your transcripts, nor does it show up on your degrees. Sorry to cut you off. I just wanted to make sure I stress that.
This is all important.
Yeah.
This is all important. And if a student, one thing I learned being in academia, if a student needs extra protection from something that happened to them in their life, they will flag the professor.
Yep.
They will. You'll see a flag near their name.
Yep.
So you have to be even more hush hush.
Yep. Because we even do something called like it's along the lines of like a wellness check.
Right. Right.
And we can, as a professor, we can get alerted. Hey, check in with your student, or hey, or I could do a wellness check with the advisor and have the advisor check in. To go to the proper channels.
Right.
But it's like a wellness check for our students.
Right.
It's another verbiage. I'm not going to get into that right now.
Right. Right.
It's another verbiage,
right.
but we do have wellness checks on students if need be.
Right. Right. Yeah. So work with your professor, utilize the resources on campus, and speak to your professor.
Right.
Speak to us. Yeah. Yeah. I don't know. Should I talk about incomplete grade?
Yes, you can.
Okay.
Yes, it's transparency over here.
Right.
And that's why I brought on another subject matter expert who's also a professor.
Right.
She just whispered, can we talk about incomplete grades? You see how passionate she is?
Yeah.
Talk about the incomplete grades.
Incomplete grade.
Let me back up.
One thing I do not encourage is for you to abuse the system, right?
Okay.
But let's say, so that's a disclaimer. Don't abuse the system. But at the same time, there are other accommodations, even when the class is over, that the professor can make for you to ensure that you get a good grade in the class.
Right.
We know that there are busy mothers out there, right? I'll use that example. There are busy mothers, there are busy fathers, single parents that just need more time, right? So the accommodation that we could make is give you a couple of weeks after the semester is over to complete your work in a timely fashion, okay? So I would give my students 2 weeks to a month, complete their work, recalculate their grade, and then submit their grade. So on your, when you check your account, it's going to show an I. So that means incomplete. Once you send those over, once you send the work to your professor, the completed work to your professor, they will help you. They will help you in that sense and give you the grade that you deserve.
Right.
You deserve.
Right.
Now the other thing I always tell people, when you see your grades and you see that either you didn't pass a class or didn't have a favorable grade, always check in with the professor because you never know what happened.
You never know.
Okay. Anthony, I will tell you, Dr. Johnson, I will tell you, and I'm sure other professors have experienced this. I had a brilliant student, like he's like the top, would be at the top of my class, right? But for some reason, he forgot to submit his final papers and his final presentation, and because all the other, like his group, his students. In his group, they all submitted. He thought he submitted his too.
Right.
Then he got a D. He got a D in my course. And then he was like, I curved him. Right. And he ended up either getting a C or something like that. But he gave all his work. He was very interactive in class. He was an amazing student, and I was even sad putting the grade in the grade book. Right, I have to be transparent with the department too.
Right.
So I sent a general email to all the students, and I said, if you have any questions on grades, see me. He saw his grade. He sent me an email. He was like, Dr. Lewis, I don't understand. How did I fail your course?
Right.
Like, that's failure for him.
Right.
And I said, unfortunately, you didn't submit this and that and the third. And he goes, oh my gosh. And a student like that, I wouldn't fail. But I have to submit the grades to the department.
Right.
So he sent those to me in a heartbeat, and he got an A. So if you're uncertain why your grade is so low, don't just say,
Reach
okay,
out.
I got
Don't
got an F.
Don't be
I'm
afraid
gonna
of
have
your
to
professor.
retake it.
Don't be afraid of your
No.
professor.
Email them and see what happened. Is there a way I could do different? Is there a grade, like, is there something that you could do can you recalculate my grade? This may be a mistake. Right. So that simple mistake almost cost him his GPA, and he's like he was like, I'm a 4.0 student.
Right.
How did I get a D in your course?
Exactly.
Yeah.
Last thing that I want to wrap up. It kind of relates to your overall why, but it relates to the job that you have now. How did you get into higher education? What brought you into higher education?
I kept my eye on the prize. I've always wanted to be a professor. I always tell my students that this is my dream job, but my journey. Okay, so as you guys know, we talked about how I met Dr. Johnson through our alma mater, and academia was something I was really passionate about because I've been a tutor since the 8th grade, right? Even probably before that. So I was always passionate about education. So I was working in different school districts, and at the time, I wasn't eligible to be a professor. I only had a master's degree. I could have been eligible, but I don't have the experience that I needed. And most of the universities were asking for a doctorate degree. Okay, so what I did is I continued my education, got my doctorate, and then it got to a point where I kept applying. I spent 10 years applying to become a professor at various universities.
Damn.
Yes. 10 years. And I'm not afraid to say that because I always tell people everyone has a story. I got great positions. I was working I was working as a health educator in a prestigious university in Florida, and I was always applying to as an adjunct,
right,
even as a doctorate student. And I was like, maybe there's certain skills that I don't have yet. That's why exactly adjunct, online, remote, hybrid, like you name it, I applied for it all.
Right.
So what I did is I did a doctoral internship at a very prestigious university.
I remember. Do you want to share that? Do you want to share that school? You want to share that university?
Sure. Yeah. It was Yale University.
Okay, yeah.
Yeah.
That's why I share it. Where was it at?
Yale University.
Okay.
I did a doctoral internship at Yale University.
Right.
I applied as an adult education teacher in back home in Connecticut, in a school district back in Connecticut, and I said I have to do what I need to do to get my dream job.
Right. They're saying in the chat, wow.
Yeah.
Right.
Yeah. So I did what I had to do. Like, y'all could ask Jessie. Just ask her my path. And I did what I needed to do. And as I was doing that doctorate internship, that's when my university called me.
You see, there it goes.
I had to work for free.
Right.
Sometimes that's what it takes.
Sometimes that's what it takes.
And that's why I always say nothing gets lost, right?
Nothing gets lost.
And after completing that doctorate, like, the doors were opening. Doors were opening.
Thank you so much. Hey, Ellie Mac, thank you for grabbing your daily heart me. Hey, Miss Keena, what's going on? Hey, Christopher, what's going on? This was an impromptu office hours with Dr. Johnson. One of my colleagues flew into town, and we were having OMG in persons. Yes, we were having a discussion off live, and I was shooting some content for her. So I said, hey, let's hop on the live so you can drop some gems with them now that I have you in person. So Ellie Mac, Miss Keena, and Christopher, this is Dr. Kherveleen Lewis. She is a public health subject matter expert. We graduated from the doctoral program together, the Doctor of Health Science. I specialized in higher education and public health, and she concentrated in you concentrated in global health.
Yes.
So she was just on here just dropping gems as it relates to the difference between public health and healthcare administration, the different career paths to take, and some of her obstacles that she's had to face within her career overall and her journey. They're saying greetings, beautiful. Okay,
yes.
They're saying, hey guys, thank you for
Ellie
sharing the
Mac?
knowledge.
Is that
Ellie, that's Ellie Mac.
Ellie Mac.
No problem,
Thank
Ellie
you.
Mac. Being like I always say, being that I'm a healthcare administration subject matter expert, I just want to make sure that I continue giving you guys or bringing on a variety. So she is an expert in public health. She is an expert in nonprofit organizations, and she is an expert in higher education.
Right.
Some new people came on in. Do you want to share with them, just a brief little background? Obviously, we don't drop any names. Let me slide over and let my friend have her space. Come on in.
My name is Dr. Kherveleen Renee Lewis, and I am an expert in the field of public health. I graduated with a doctorate in health science with a concentration in global health. I also have my master's in public health, specializing in health promotion and disease prevention. I'm in the nonprofit sector. I'm the founder of the Bread Foundation. I always say it's my God-given foundation.
Right.
And we specialize in providing medical resources and educational resources to impoverished communities.
I love that. Thank you.
Whether it's locally or globally.
I love that. So you guys, it's also important to make sure you are surrounding yourselves with like-minded people, surrounding yourselves with like-minded individuals. Sometimes before I hop on the lives with you all and share this information and these gems with you all, I will call her and say, hey, I'm going to be coming on there and talking about this, and this. What's your public health expertise, or what's your perspective on this? And she would tell me how to introduce it. She would tell me what correct verbiage to use. So once again, healthcare is collaborative, and it's also
you see what you did? Interdisciplinary.
Right.
Interdisciplinary.
Healthcare is collaborative. Moderators in the chat. Healthcare is collaborative and healthcare is interdisciplinary.
Right.
And Ellie Mack, I just want to give you a shout. Not to put you out there, Ellie Mack, but thank you so much. You recently shared a small win with me, and I'm so proud of you, and I'm so glad that you shared that small win with me. Do you want to share that small win in the chat with us? You can just jump in the chat real quick if you feel comfortable. But share that small win within the chat, because like I told you, we always have to acknowledge and praise our small wins.
Yep.
Ellie Mack is studying, I think it is healthcare administration. Now she's working on her bachelor's degree in healthcare administration, but it's a similar fields. And she shared with me a small win. It was just a brief little check-in, and it was a small win. And I was so proud to hear her. I passed my first course in my undergraduate in healthcare administration after being out of school since 2010. Can I have a round of applause in the chat? A round of applause in the chat. Can I have a round of applause in the chat for Ellie Mack, who passed her first class? And guess what? I'm sure she was a little bit nervous. I'm sure she was a little bit apprehensive about going back to school and being out of school for so many years.
Yeah.
But just thank you so much. Thank you so much, my supporters. That is what it's all about. Comments like what Ellie Mack sent me the other day is why I come on here and do what I do. Okay? Thank you so much. Thank you. Shout out to y'all. So Ellie Mack, continue the great work.
Right.
Hold on. I'm an Army veteran in health. I'm an Army veteran in healthcare now as a medical assistant, trying to help the VA now. That is so. Thank you. So once again, thank you for her service too. Thank you for her service too. And Ellie Mack, once again, like I said, your small wins is still a win.
Yes.
Okay, so some people may be like, okay, yeah, you passed your class. You've been out of school for what, 2010? That's 15 years. Higher education has changed since 15 years ago. Okay?
A lot.
Higher education has changed. So the school that you attended in 2010 is not the same as school you attended in 2025.
No.
The processes are different. Higher education has changed. So kudos to you for being diligent. Kudos for you for being determined. And kudos for you for having your eye on the prize. And that prize is your bachelor's degree in healthcare administration. So once again, kudos to you and congrats to you. Yes, Ellie Mack said it's so different now. It's so much better. Technology has helped so much. Yes, it definitely has. So that means don't use AI too much. Okay?
And working with the VA, they only go after the best of the best.
Right. Right. So
it's not easy.
It's not easy.
It's competitive.
It is very competitive.
Kudos to
so
you.
kudos.
Congratulations.
Exactly.
Right.
So I didn't want to put you out there like that, Ellie Mack, but I wanted to make sure I highlighted your small win because it's still a big win in your eyes. Okay.
Yeah, and in ours too.
Right. I just want to make sure I didn't miss anything in the chat before we wrap things up. Well, you guys, I just wanted to just bring on Dr. Lewis on here. We executed some content for her page. She's going to be teaching about public health. She's going to be teaching about nonprofit organizations.
Right.
She's going to be teaching about mentorship for students and building her community around everything public health, mentorship, and faith-based. Thank you so much, Mandy, and everything faith-based.
Right.
So I just wanted to make sure that I brought her on here so you guys can see a familiar face. So once you see her content popping up, that's somebody who I got to tap into, okay? I know her by way of Dr. Johnson. So this is Dr. Kherveleen Lewis, public health subject matter expert. Pals, welcome on in. Thank you for grabbing your daily heart meet. We were just wrapping up the live. This was an impromptu surprise office hour session that I had Dr. Lewis fly into Miami to come and visit, and I said, hey, you got to jump on the live with me. So thank you for joining, everybody. Pals, you missed it, but this will be on YouTube. For those of you who have asked, my office hour sessions do get uploaded over to YouTube. My YouTube channel is in my bio. The YouTube channel is in the bio. Once again, thank you so much, pals. Thank you so much. Okay, pals. Okay, pals. That's a great way to end the live, pals. Thank you so much for your support. That was a great way to end out the live. Everyone have a good evening. Everyone enjoy your 4th of July. Any last words, Dr. Kherveleen Lewis?
Happy 4th of July.
And where can they find you?
At Curvy Lewis.
Curvy Lewis, she's on here. Curvy Lewis, I think we drop a hello in for the new people that came in. Drop a hello in the chat so they can know where to find you, so they can know where to connect with the public health subject matter expert, Dr. Kherveleen Lewis. Okay, she just dropped in the chat. Have a wonderful evening. Thank you for the information. No problem, Mandy. No problem, Aaron. Thank you so much. Did you drop it in the chat?
Yes, I did.
Oh, I don't see. Maybe it flagged it. You know how TikTok is. There you go, Dr. Kherveleen Lewis. That is her page. And look out for public health content. Look out for healthcare administration content. Thank you so much, moderator, for putting in the chat. And look out for mentorship content. It is all coming very soon. Have a great night, everyone, and enjoy your 4th of July. Chuck up the deuces.
Bye.
Okay, good night.